People tell me to be cautious. People tell me not to lose my self-control. People tell me to be flawless. People tell me not to let myself evolve. And I think I don't really get it. I think it's all just a peculiar game. And soon I wake up and I'll forget it. And everyone will know me by a different name. I want it to be stronger. I want it to be everything for you. If I could be stronger, would you believe that I could love you like you want me to?
Love you like you want me to. Like you want me to. Love you like you want me to. Like you want me to.
I held my breath every time I tried to keep myself dry, but did I ask too much? If I could do it again, would you believe what I said? That I still want that rush. And I think I don't really get it. I think it's all just a peculiar game. And soon I wake up and I'll forget it. And everyone will know me by a different name. I want it to be stronger. I want it to be everything for you. If I could be stronger, would you believe that I could love you like you want me to? I wanna be strong for you.
Love you like you want me to. Like you want me to.
I wanna be strong for you.
Love you like you want me to.
I wanna be strong for you. And I can, yes I can. If only you could promise that you would try to. I'll be there, I'll be there. I wanna be strong for you. If only you could promise that you would try to. I'll be there, I'll be there. I want it to be stronger. I want it to be everything for you. If I could be stronger, would you believe that I could love you like you want me to?
Good morning. We only have a few viewers at this point. We just had to change one of the links. I guess this is what happens when a lot of people are trying to access the internet because so many people are working from home. We will be with you in a couple of minutes. We're just going to let a few more people join so that they don't miss the beginning, and then we'll be with you. So just please hold tight, and I think you'll see the slide with my name for a while. Thank you. All right. Good morning, or good afternoon, or good evening. Sorry about the 15-minute delay. We needed to do quite a few things. And yes, there is a new link. Hopefully we won't need any more links. As you will see from Slido, we're using Slido as interactivity, so that is one way you can find out exactly what's happening. Thank you for all those people who've jumped in. On top of that, I'd also say that the Domologica in this together is a landing page for the entire this morning. We'll have resources there. There are resources there, and we're trying to keep that updated as well. With the excessive traffic this morning, it's there. But good news is I've got at least 200 different locations which are logged in at this point, with some of them with several people at once. Global Tribe. This is, look, we're in this together. It's a big time for us. It's difficult days, and this coronavirus pandemic obviously has affected each and every one of us. But the idea is to put something together which is special. In times like this, it's really important to listen to real expertise. We've always been about expertise, but today the science is just so important. And when I think about science and what I would like to hear from, and I'm sure you would, it's really epidemiologists. It's the scientists who deal with diseases and know what to do. I remember many years ago, it's probably in the early 90s, I saw a film actually called And the Band Played On, which was about the epidemiologists who identified the early patients of AIDS and really helped the pandemic come back under control. So that was just so powerful in my view that I've always had a lot of respect for epidemiologists. And I'm so pleased to say that today we're going to have Dr. Kavita Trivedi join us. So she's got passed from the CDC, she has passed from she just came back from the WHO in Geneva a few days ago, where she was working on corona as well. And we're very lucky to have her, and she'll be answering lots of questions. This is all going to be taped, so if it drops or anything like that, you'll be able to look at it and watch it again later, and hopefully as many people as possible can see it. Two parts today. The first part is, how do I deal with the virus, essentially? We're a human touch business. Everybody online today, we're therapists. We do skin treatments. That's what we do. We teach skin treatments, we do skin treatments. So how does that mean? Obviously, there's a short-term shutdown. We hope it's short-term. Many things, where the most appropriate thing is total social distancing and close down of businesses. But eventually, things are going to come back. And how, at that point, can I do a skin treatment safely, both for me, for my staff, and also, obviously, for the consumer? So when we put this all together, that's what the first half's about. The second half is to deal with what are the business issues that we need to deal with, all right? What can we do in a time where the physical is so much more difficult and the digital needs to be elevated? Where can we turn for resources? So those are the two halves of what we're going to do. We're using Slido throughout, so you can ask questions, and then we will and vote on those questions. We'll put them live, and then you can vote on them. And then without too much further ado, I would like to transmit now to Dr. Trivedi. She's speaking to us from San Francisco, and please take it off.
Good morning. Thank you all so much for joining this morning. As Aurelian mentioned, my background is in epidemiology. I'm also a practicing physician in the emergency department here in San Francisco. And I have been helping a lot of companies and individuals with guidelines and practice around coronavirus, this novel coronavirus. So with you this morning. So we can start with my first slide.
First slide.
Novel coronavirus is what this particular virus has been called in the media, is an infectious disease caused by a particular name of a virus, which I'll tell you in a moment, that was not previously identified in humans. So because of that, none of us have any immunity to this virus and therefore are falling ill when we interact with this virus. It causes respiratory illness like influenza or the flu, and the symptoms are similar to flu, such as cough, fever, headache, and shortness of breath. As you all know, this virus was first identified in Wuhan, Hubei province in China in December of 2019. Next slide. And then that image on the corner is actually an image of the virus itself. So SARS-CoV-2, which is the name of the virus, causes the disease that we're now calling COVID-19. So I think that is important to understand that difference. It's similar to HIV causing AIDS, right? So SARS-CoV-2 is the virus, causes the disease of COVID-19. WHO, the World Health Organization, based in Geneva, Switzerland, declared the outbreak a public health emergency of international concern on January the 30th of this year. And then just in the last week, declared COVID-19 a pandemic on March 11th. And what pandemic means is that this infection is now a global outbreak. So that's what we're now dealing with. Next slide. So on the next slide, I've put where we are as of March 17th. And these numbers, as you all know, are changing so much. So even last night, after I updated these slides, they have changed already. The WHO is reporting, as of yesterday, 187,000 confirmed cases of COVID-19, with close to 7,500 deaths in at least 140 countries. And those include provinces as well. The U.S. Centers for Disease Control and Prevention reports 5,300 confirmed cases with 96 deaths, and this had already reached 100 deaths by late last night in 49 states and 3 U.S. territories. So we're now seeing it across the U.S. as well. One thing to note is, especially in the United States and in other places, there has been a really stringent criteria on who can be tested. So these numbers are certainly lower than the actual rates of infection. So these do not include the many people who have symptoms of COVID-19, but are mild in terms of their symptoms and have not been tested. Next slide. So the numbers are definitely a lot worse than what we actually know. So let's talk about transmission of SARS-CoV-2. This virus spreads person to person via respiratory droplets that can get into your eyes, nose, and mouth and cause infection. So the entry point is any mucosal membrane. So eyes is one that I think a lot of people have forgotten. So just remember that you can be infected through your eyes as well. It also, the droplets can remain in the air for some period of time. And then the other place of transmission we're seeing is from surfaces, or fomites, we like to call them. These are surfaces where a sick person's saliva can get on objects, and then the objects can serve as transmission objects. So if you touch any of these objects and then touch your face or rub your eyes or your loved one's face, you might all potentially get sick. So I've just listed here different fomites, and these of course can be anything, especially hands. That's why we're hearing so much about hand washing, doorknobs, train straps, you know, the straps that you hold in the public transport, pens, your mouse that you're using for your computer, or any digital devices, especially digital devices, because we use hands to touch our phones. Tissue, so tissue that you've sneezed into or coughed into, any elevator buttons that you've touched or anybody else has touched, cups, the staircase, or outside of a face mask. So a lot of people are worried about face masks and wearing face masks, but people have to remember that the outside of a face mask also can have saliva or secretions from sick people, and so those can also serve as fomites. Next slide. And let's talk about how long the virus survives on surfaces. So what we know right now is that this virus survives on plastics and stainless steel for up to 72 hours. So it's pretty hardy on hard surfaces, and on cardboard for up to 24 hours. However, the good news is it's easily killed with bleach and solutions with at least 70% alcohol. So here we have a picture of all the different Clorox products. In the United States, we have the EPA, which is the Environmental Protection Agency, that has given us a list of all the possible disinfectants that are able to kill this particular virus. So I would encourage you, wherever you are, to be using approved disinfectants, especially in your homes as well as in your offices, to make sure that you are killing the coronavirus. Next slide. So let's talk about symptoms. Most people, around 80% of people, will have mild symptoms that do not require hospitalization and will recover. This data is coming from about 44,000 people in China. So our Chinese colleagues were really have been really wonderful with sharing information from the initial outbreak site in Wuhan. 14% of those first people to fall ill have had severe disease. Severe disease meaning shortness of breath, requiring some level of hospital care. And then 6% of people infected with the virus have been critical and have required ICU level care. So here is where we're talking about ventilators and really stressing the healthcare system in all of our countries. The other thing to note is the symptoms of COVID are very similar to other respiratory illnesses. So folks have had a difficult time, healthcare providers all over the world have had a difficult time determining whether or not an infected person has COVID, has co-infection with COVID, as well as with other respiratory illnesses, or simply has another respiratory illness. So diagnosis is not simple. Next slide. So again, this data is coming from our Chinese colleagues, 55,000 people in China who had confirmed COVID-19. As you can see from all these symptoms, fever is the most common symptom. So 88% of their confirmed cases presented with fever and dry cough. So those are the two most common symptoms for patients to have. The other thing I wanted to note, in the United States, we're seeing a triad of really fever, cough, and headache. Headache looks like it wasn't as predominant in our in the Chinese cases. However, that is typically what we're seeing in the United States. That seems to signify that patients may have this infection. Next slide. So here is, again, data out of China. This is out of that same group of 55,000 cases, and it shows you mortality rate by age. It's important to look at this information, I think, especially for USPSTs, to think through which group of your clients may be at more risk for infection. So you can see that luckily in 0 to 9 years of age, and that group, there has been no mortality with such a large case population in China. So as you've heard in the news and in the press, young people seem to somehow not be falling terribly ill from this infection. So that's very helpful for those of us with kids, of course. In the 10 to 40 age group, we see a very similar mortality rate that we see to influenza. So 10 to 40 is 0.2% mortality rate by age. But then after you get over 40, and especially when you get into the 60, 70, and 80 range, you have a really high mortality rate. So in the 60 to 69 age group, 3.6%, 70 to 80, 8%, and 80 plus in the 15% group, in 15%. So as we're hearing from Italy and other places that are dealing with lots of death at this point, our most vulnerable group is our elderly, and particularly our most elderly, which is our group of over 80. So just to keep in mind, we really need to protect our older population across the world right now. Next slide. And then the other thing that our Chinese colleagues did, along with the WHO, was identify the mortality rate by underlying condition, again, in their group of 55,000 cases. So when they looked at cardiovascular disease as an underlying health condition, that increased mortality rate to 10.5%. So if you have some sort of background of cardiovascular disease, which usually includes having previous heart attacks or some cardiomyopathy, that can significantly increase your risk of dying from this particular virus. Diabetes also increases risk significantly, as does underlying chronic respiratory disease such as asthma or any lung disease from smoking. High blood pressure also increases the mortality rate, and cancer. So I have had a lot of people ask about this in particular. Does this also include people that have recovered from cancer? It's unclear. We don't have that level of data out of this report from China. I would just think that anybody with a history of cancer does have an elevated mortality rate from this virus. Next slide. Again, important for you all as PSTs as you think about how to start taking care of patients again. The other thing to note is asymptomatic spread. People who are sick can show no symptoms but are still very infectious. So this is actually relatively new data coming out of the laboratory science groups out of the United States. So people that are sick can show no symptoms but are still very infectious. And in fact, it looks like people may be more infectious before they have any symptoms of coughing or sneezing. In one study that was just published, I believe, a couple of days ago, more than 10% of patients were infected by somebody who had the virus but did not yet have any symptoms. So, this is extremely concerning for many of us who are trying to protect ourselves from people that are coughing and sneezing. Just note that it appears that we may be able to get sick even from people that are not visibly showing any signs of any symptoms. Because of this asymptomatic spread, that is why generally people are recommending it is a good idea to avoid crowds, because you don't know right now who's actually sick. Next slide. So another thing to think about is, what does it mean to have direct contact? So, and I've had this question asked to me a lot as well. This is actually a definition from the US CDC. So direct contact, we believe, is being within approximately 6 feet or 2 meters of a COVID-19 positive person for a prolonged period of time. So prolonged period of time is really considered anywhere between 3 and 10 minutes and longer. So close contact can occur while you're caring for somebody, living with somebody with COVID-19, visiting somebody with COVID-19, or sharing healthcare waiting area or a room with a COVID-19 positive person. So we're really talking about very infectious disease, able to shed even when the person doesn't know that they're sick, and really being anywhere around 2 meters around the individual can potentially infect you. And then, of course, the other direct contact is having direct contact with infectious secretions of a COVID-19 positive person. So this is being coughed on or sneezed on, having any contact with infectious secretions. I think that one is a little more clear. The direct contact within approximately 6 feet is a little more difficult, especially if the person is not showing any signs of disease. Next slide. So what have you been hearing and what do we all know about prevention? This is our moment for hand hygiene. This is our moment to show and to demonstrate that we actually understand how to clean our hands properly. So we are recommending cleaning hands often with soap and water for at least 20 seconds. And as my kids have asked me, does that mean 20 seconds of putting the soap on? No, that's actually washing your hands with soap and water, both sides of your hands, in between the webs of your fingers for at least 20 seconds. So when do you do this? I think this hasn't been as clear in the press, and I think it's important to talk about this. You need to do this after you have been in any public place, blowing your nose, coughing, or sneezing. So anytime your hands have interacted with any place, any fomite, as we defined earlier, that is when you should be washing your hands. So you typically should be washing your hands 30 times an hour is probably what it looks like in terms of how much you should be washing your hands, because we use our hands all the time to do all different things. So you should be washing your hands very frequently, I would say right now. Soap and water is the preferred way to wash your hands. The second preference is hand sanitizer, which should be with at least 60% alcohol. And then in the US, we actually can't find any more hand sanitizer in the stores. You can also make your own hand sanitizer. I have listed the proportions there. You just mix together rubbing alcohol and aloe vera gel, both of which you should be able to still find in most places. Next slide. This I thought was important, especially for you all as PSTs. This is something we talk about a lot in the healthcare setting. The 5 moments of hand hygiene, the 5 times that you should be considering when you should be washing your hands. Number 1, it should be before touching a patient. So before you actually touch the patient, we often recommend that you wash your hands in the same room as where the patient is, so the patient knows that you've washed your hands. I know that some of you are already doing that with your clients. Before you do any even cleaning procedure, you should wash your hands. After any body fluid exposure risk, you should be washing your hands. In this particular image, we're talking about if you're interacting with blood or urine, but any type of body fluid exposure, you should wash your hands at that moment. After touching a patient, you should also wash your hands. So these are all moments that are important to remember to wash your hands. And again, I would not be surprised if in your practices you're washing your hands at least 30 times in 1 hour. Next slide. Oh, and I should say also that, of course, we're still washing our hands before and after we go to the bathroom, and before and after we eat food as well for everybody. So how else can we prevent the spread of this virus? We should not touch our faces or anyone else's face. I know this is really difficult, especially for parents and caregivers. And when I talk about this, I'm not talking about you all. I'm talking about, in general, we should, not be touching each other's faces, just unless we're doing a procedure. If you must, wash your hands first and consider wearing gloves. So this I put in there for you all as PSTs, since your livelihood will be from touching faces. You should strongly consider wearing gloves. Also, do not share food with other people right now at all to prevent the spread of virus. Utensils, cups, or towels. Open and close doors by using elbows and shoulders and feet as much as possible. The less fingers and hands are being used, the less that you may spread any infection to yourself. And elevator buttons. Next slide. I didn't mention earlier, but something else to keep in mind is we have many families around the world that live in extended families where there are children, adults, and grandparents all living together. There is some discussion around why this virus spread so quickly through China and Italy, and some discussion about the fact that there are a lot of intergenerational families in those countries. So be particularly careful of your families and clients that have kids that are living with grandparents. In those situations, I would be hyper vigilant because, again, your child is most likely going to show mild infection, if any infectious symptoms at all, and they may be unknowingly spreading the virus to their grandparents. And again, this appears to be what we saw in China and Italy. So clean and disinfect the environment daily. This is not just for your offices, but this is also for your homes. So make sure to clean and disinfect frequently, touch surfaces daily to prevent infection. You know, in our household, we're making it a fun thing for the kids to do, washing the hands and taking the wipes and walking around the house, wiping down tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks, handles. I mean, all of these places that we touch on a daily basis. It's important to clean, and especially in your offices as well. Of course, if the surfaces are dirty, make sure to clean them. Use detergent or soap and water prior to disinfection if they're actively dirty, right? If there are real secretions on them. And then, of course, then the idea is to disinfect. I've mentioned here the most common EPA registered household disinfectants will work. There is a long list on the EPA site. And make sure you use the right disinfectant for the right surface. So the label of the disinfectant should tell you which surface it's appropriate for. Next slide. So I wanted to mention this because I know you all are in different parts of the world and are at different phases of the way your communities are responding to this pandemic. So these are incident management phases and activities. The main 4 phases are preparedness, mitigation, response, and recovery. Some of you may be in the preparedness stage. You may not have seen many cases at all in your communities. At this point, you should be planning what actions are needed in the case of the virus entering your community. The other thing that a lot of us have experienced is containment, quarantining travelers and investigating contacts of people that are ill. I hope this is still working. So many of us were in the containment phase for a few months while we quarantined travelers and investigated any of their contacts. Now many of us are in the mitigation phase, where we're preventing we're preventing the virus to reduce the damage from it at the community level. So these are where we do societal intervention. So currently in the United States, many of us are doing this. We're experiencing social distancing. We're trying to mitigate how many people actually get the virus. Eventually, we will be in response and recovery. Response meaning activities that occur during an actual emergency. You know, some of our healthcare systems are already in the middle of this since they're dealing with many cases and trying to figure out how to mobilize resources to not only take care of those with the virus, but also take care of those without the virus that are just, you know, having routine health problems. And then eventually we will be in recovery, where we observe and evaluate all of the damage that has taken place, and we figure out what needs to happen next. And I will emphasize that there is a lot of concern that we will have another peak of this virus later in the year when it becomes cold again in many parts of the world. So, many of these actions our actions now will need to be lengthened and prolonged so we can prevent ourselves from being in this situation again. Next slide. Sorry, next slide. I will say also that I think it doesn't really matter which phase you're in right now. I think all of us need to be thinking about how we move on from this particular pandemic and get to the next, how we move on from this pandemic and how we continue our lives in a kind of a normal fashion as much as we can. So these are my last couple of slides. You've probably seen this in the press, but I did want to describe this to you all. We're talking about, as epidemiologists, flattening the curve. So this pink graph shows you what happens with an epidemic when we do have no intervention. So you can see on the x-axis is time and the y-axis are cases. So as we go along in time, we get more and more cases exponentially if we have no intervention. And you can see the dashed line is the capacity of our healthcare system. So, and as you know, we saw this in China, and we are seeing this currently in Italy, where the healthcare system was overwhelmed by the number of cases of new infection from COVID-19. So that is what can happen when you have no interventions. If you implement protective measures, the personal measures are the ones that we talked about, hand hygiene and safety measures, cleaning, disinfecting your homes, your offices. If we implement community protective measures such as social distancing, which many of our communities are dealing with right now, if we do the environmental protective measures such as cleaning surfaces daily, if we implement all these protective measures, then we can flatten the curve and be the purple curve here, our purple graph, where we are able to limit the number of infections coming in. It doesn't rise as exponentially, and it certainly doesn't peak, and our healthcare system is able to handle it. So, so this is what we're talking about right now with all of these different measures, and I know that this is happening across the globe. It's important to know what we are hoping to accomplish. If you have fewer cases in your area, then you have accomplished flattening the curve, and that's exactly what we're trying to do. Next slide. So in terms of protecting your patients and protecting yourselves, this is just my slide to relate directly to what you all are doing. If you are a PST practicing during the pandemic, first of all, depending on where you are in the world, you probably should not be practicing if you're in an area that is experiencing social distancing. But if you are practicing, you should consider wearing gowns, gloves, masks, and eye protection while you take care of patients. And the reason for this is really because of asymptomatic spread and because of the proximity you will have to your patients, that less than 2 meters from your patients for a period of time. The purpose behind wearing the gowns, gloves, masks, and eye protection is to both protect yourself and not pass on the virus to your patients, but also so to protect yourself and also not get the virus from your patients and give it to other patients. The other thing I would mention is that in certain areas we are having difficulty with availability of protective equipment. So consider if your healthcare system has enough protective equipment before you decide to use gown, gloves, masks, and eye protection for your particular practice. So we really want to make sure that our medical providers have all the protective equipment they need to take care of our most sick patients. So just try to weigh that with your own stash of protective equipment. And the other thing I want to mention is try not to reuse surgical masks for different patients. Surgical masks are really not meant to be used in between patients, although we are seeing that right now a lot in the communities, but especially for you as a provider, it's not recommended to reuse surgical masks for different patients. So keep that in mind. Prior to putting on any of your protective equipment, make sure you wash your hands for at least 20 seconds. And of course, be careful to not touch your face while you apply the mask or any of the other protective equipment. I have seen many people in the community put on a mask, not washing their hands beforehand or not using any hand sanitizer, and then touching their face in the process, which actually defeats the purpose of using the mask at all. Next slide. Remember, our most high-risk people are our clients and our patients who are at risk for complications from COVID-19. So again, those are anyone over the age of 60 or having any underlying health conditions. So in these high-risk people, I would definitely consider delaying any treatment because we do not want to get them sick and have them need the healthcare system and go to the hospital and need critical care. Next slide. I think this may be my last. So in case you came in late or didn't understand everything that I was describing, a couple of take-home points about COVID-19. Again, SARS-CoV-2 is the name of the virus. COVID-19 is the name of the disease. We are in a pandemic, and obviously there are widespread implications from this pandemic. The vulnerable population right now that we are seeing are anyone in 60 years of age or more, especially those 80 years of age and higher, and those with any underlying health conditions. We have specific directives in many countries that people that are 60 years of age and older do not go outside of their homes, try to limit their interaction with other people. We are very much concerned about that population with this particular virus. Asymptomatic spread is possible, and therefore protective equipment is important if direct contact is expected. So just because you have a client that is not coughing or sneezing, that does not mean they cannot pass the virus on to you and thereby you passing it on to other people. So the asymptomatic spread is very important and may even be one of the major reasons that we are seeing so much spread of this virus at all. And then the pillars of prevention are hand hygiene, making sure you wash your hands for 20 seconds, cleaning and disinfecting surfaces daily, and decreasing direct contact time with really anybody. So we want to limit our interaction with lots of random people, people in our community. We want to be at least 2 meters away from most people that we come in contact with. And my last slide. So, and this is not meant to be depressing for any of you, but I do want you to think through that this is a marathon and not a sprint. We are going to be dealing with this pandemic for quite some time in many parts of the world. And so, really think through how you can sustain yourselves and make interventions that you can keep going for a long period of time, because we are going to be dealing with this, unfortunately, for quite some time. So I will end on that sad or pessimistic note, Aurelian, and open it up for any questions that your listeners might have. But this is my contact information. In case any of you have any questions, you can follow me on Twitter, and I'm happy to help.
Thank you, Dr. Trivedi. That was an incredible presentation, and I think a huge amount of help for all of the people listening. We'll go to questions in just a second. Just before that, though, I do want to sort of tell the visitors out there and we've had more than 1,500 live streams, and that's a lot. We're not CNN, and we had a pivot to do this. This isn't something we do on a regular basis. So I believe that the systems are running well. I do know that some of you had some difficulty getting into the beginning of this of the stream. But rest assured that everything is going to be available on the web in a high-quality live stream that we have discussed today. Also, we will be sharing the slides as well as other resources we're talking about today. And that's going to all be at dermalogica.com in this together and accessible, freely accessible. Okay? As we start thinking about the questions, there were a lot of them, so maybe I can throw you a rather difficult one first. One of the PSTs online has asked, as there's no cure or treatment, will this just go away with time?
No, it won't just go away. We will most likely see, as the warmer months start coming into certain places, the virus will naturally start being limited. And then what we're worried about is, as our interventions, as our social distancing maneuvers start being difficult for people to implement, we will then see an increase in infections again. We are very much thinking that we will be dealing with this virus for 12 to 18 months, really the time that we will see a vaccine. So, for those of you who understand what the world is trying to do, we're trying to develop a vaccine that is already in clinical trials currently. It won't be for another 12 to 18 months that is available. So that is probably when we will see the biggest decrease in cases, once a vaccine is available. And then, of course, is the problem with a lot of people not wanting to take the vaccine. So, you might even start talking in your circles to family and friends about, when the vaccine is available, that should be something that is a priority for everybody to actually take. And at that point, we then should see enough herd immunity that we will see a steep decline in cases.
Okay, well, that's very, very useful. I know, a hard question. So let's take it to a lighter note. You suggested how to home make hand sanitizer. We have questions about whether we can make it with vodka or people with only 70%.
So yes, so you can, if you have 70% isopropyl alcohol plus aloe vera gel, that will still work. I would recommend a higher level, because what you're doing is you're then diluting the aloe vera gel within the isopropyl alcohol. I don't think it's hard to get any of those substances currently, so hopefully you can find a higher level of isopropyl alcohol. But no, vodka will not work. Vodka can help just get you through being close to your family for a prolonged period of time.
Yes, they do say that sort of living in such close quarters is something that we're all going to have to learn to do as well.
Correct.
There were a lot of the questions, it became very clear that because of asymptotic, I can't even say the word, but symptoms, basically not being able to see the symptoms, protection is so important. So there have been a lot of questions about exact protection. There was a question about, what sort of glove can I use? Is there a difference between medical gloves out there?
No, what you're doing is you're just providing a barrier between you and the virus. So it doesn't matter. I think people asked about latex versus other gloves. It doesn't matter what the material is, as long as it's some sort of glove. You're preventing the virus from getting on your fingers and your hands. So it doesn't matter what the type of glove is.
There's also a question about heat. And does heat kill this virus? And is that helpful or not really?
Yeah, there are some studies coming out of Singapore regarding reusing masks that have been used for a patient or have been used for 24 hours. And I can't say whether or not I believe those studies yet. I don't think it's a strong thing within the medical literature that heat kills the virus. We do know that just from seasonality trends in coronaviruses in general, because we do have a history of understanding coronaviruses in general from our previous experience with SARS and MERS. We do know that when the environment warms up, we see less cases of coronavirus. So there is some thinking that heat can kill the virus. Right now, what we're suggesting is bleach and 60% alcohol. So I think that I can't say right now whether heat itself kills the virus or not. I think that data is emerging. I will say that we just met this virus 12 weeks ago. So all this information that we are learning is brand new and literally changes every single day as more and more laboratories and scientists are focused on this particular virus.
And so if I link that then to some other question about steam, because steam is extensively used in a therapist's procedure. Is the steam, well, that helps remove toxins from the skin. Does it do anything to the virus on the face? Is there anything about proper distance if the steam is being pushed onto a consumer's face?
Yeah, that's a good question. I remember reading something about somebody asking that earlier. There is some data showing that humidifiers, right, which is similar, the steam in the room, moisture in the room, can actually prevent the virus from latching on to surfaces. But again, that data is a little less strong, so I wouldn't say that is hard in stone. But I don't see any reason not to use steam. And I think this, if there's a way to maintain yourself at least 2 feet away from the client, that would be better. But again, if you have to be closer to the client, regardless of steam being there or not, the personal protective equipment would be highly advised.
Okay. I got a question here, which is, when washing hands, I'm using antibacterial, but my boyfriend is washing his hands with basic soap. Does that matter? I guess that sort of leads into, especially being a company that sells soap, sells cleansers, and all the therapists who are using cleansers extensively. Is soap just soap in terms of the virus?
Yes. So luckily, in all the studies that we've seen, soap is very active against this virus. So we are recommending for that person who asked the question, the boyfriend's actually doing the 100% right thing by using soap and water. We recommend using soap and water. So wherever you can get a sink that has soap next to it, that's how we're recommending washing hands. So for your PSTs, that is obviously a great thing to know, because you have the sink usually in the room and you're often able to wash your hands. So that is important. Hand sanitizer is the next best thing that you can do. So what I do is I'm now keeping hand sanitizer in my coat pocket. So when I'm in the car or I'm, going places, when I was doing that, then I would use the antibacterial and have it right at hand to be able to clean my hands. So number one is soap and water. If you have a sink, that's what you should use first. And number two would be hand sanitizer if you don't have access to a sink.
Okay, now I think we only have time for maybe 1 or 2 more questions, and then we'll try and get to some of these other ways, because there's so many of them, and we try to make sure the resources that we post as well will hopefully deal with many of the open questions. But there's a very just obvious one here, which is, if somebody sneezes on you, what do you do?
Yeah, so if somebody sneezes on you, I guess the other thing to mention that I didn't talk about today was, we still have common colds running around our communities. We still have influenza. We still have lots of other respiratory illnesses that are running around. So just because someone sneezes on you doesn't mean you automatically have the virus. Okay, number one. Number two, if somebody sneezes on you, you want to clean that off as quickly as possible. So again, I would try to get to a sink. I would try to, if somebody sneezes on your clothes, I would actually take off your clothes and wash them. I would try to clean up the area as quickly as possible that has been sneezed on. And then I would just remain calm, see what your symptoms are in the next 14 days, see if you have any symptoms. As I said, we think that people are most infectious before they're coughing and sneezing. So, hopefully, if the person was infected with coronavirus, the amount of virus that then got on you would be lower than it would be during the asymptomatic time. So, again, wash whatever you can off, clean it quickly with soap and water, and remain calm and observe what your symptoms are after that, is what my recommendation would be.
Look, Dr. Trivedi, thank you so much for being part of this morning. It's meant so much to the thousands of people who've logged on. I know that you've taken your time away from your practice and from a lot of the other work you're doing on this virus. I know that it was also helped by people who are at the front lines and doing the airport screening at the CDC, and all these people who came together to actually even get this information together for us. So thank you very, very much. We're going to move swiftly on, and we're going to start talking about the business aspects of what does it mean to have a downtime and what can you do. And for that, I'm going to cut to a quick message from our founder, Jane Wurwand. Thank you again, Dr. Trivedi.
I'm really pleased to be able to join you today and be part of this educational event. In 1983, when we launched the International Dermal Institute, we led with education. It was another 3 years until we launched Dermalogica. And today we're being joined not just by Dermalogica skin therapists, but skin therapists from around the world, and we are all part of the same tribe. We led with education always in our company, and in 1984 we were facing a very different challenge and a very different virus. It was HIV, and at that point we pulled in the top epidemiologists from UCLA and the top experts from AIDS Project LA, and together and collaboratively we designed an education program around that virus and how we could educate skin therapists to keep themselves and their clients the most safe. We now have come to this point in our planet's life, and we're battling another virus, COVID-19. And again, we will lead with education. We have assembled a range of experts which are happy and willing and excited to share with you what we know, what we don't know, and what we believe are the best protections and procedures for us to adopt. I want to tell you that when we've come through this virus, and we will come through it, I know that we will be even stronger, even more connected. I believe that skin therapists and people like us are the cavalry. We're bringing kindness, empathy, human connection, and human touch, and it has never been more needed. I believe we're going to see a new era of that kindness, and our work will lead the way. You are important. What we do is incredibly vital. And I thank you for being part of the education that we provide. Happy to have you as part of the tribe. Stay safe, stay healthy, stay connected.
Hello, Tribe. My name is Tabby Zamani, and I'm the head of Global Education. From all of us here at Global Headquarters to everyone tuning in around the world, we wanted you to know that we are committed to the success of our tribe and that we are all in this together. This session is dedicated to answering some of the questions that you may have by providing tools to help protect and support the skin therapist community. You've already heard from our founder, Jane, and now we are going to provide some action steps and a framework to create a resiliency planning approach that can be tailored to meet the unique needs of your business. We are also going to show you ways to continue to engage your consumers through strategic business approaches. Now, more than ever, consumers have the ability to take time for self-care. Skincare is self-care. During this very moment, we can use the power of education coupled with digital technology, where we can captivate the consumer's attention to continue to engage and build relationships. In this session, we will review the tools that you can use to stay connected through the power of ProSkin. We will highlight ways that you can shift your business strategy by utilizing social and digital platforms, which will allow you to continue to build your relationships and convert your sales through virtual engagement. We will give you guidance on how to create business continuity through financial planning with the appropriate resources. And now I will turn it over to Heather Hickman, the Director of U.S. Education, to take you through ways to stay connected through the power of ProSkin. Thank you.
Hi Tribe, how are you? If we have not met before, I am Heather. You can see by the slide here I have a really fancy title, but really what I am is a professional skin therapist. So what we wanted to do is share with you some ideas and suggestions of how we can all work together while we're going through this changing landscape. So staying connected through the power of ProSkin is something that's going to be vital for all of us. One thing that I really believe is that we are classified incorrectly with what we do. We're classified as being service providers. I disagree with that. We're caregivers. And it's important that we're able to reach out with that care, reach out with that touch, and be able to help you to be able to keep your businesses running through a time when we're dealing with social distancing. So what now? What do I do? We're talking social distancing. We're talking about touch-free environments. Maybe you have many cancelled clients. Maybe you have had to close your business and are unable to offer your professional skin services right now. So we hear you. You need help. So what we want to do is work together as a tribe to be able to give you some ideas and support of things that really you can do to get through this time. Your touch is powerful in many, many ways. But what we need to do now is changing how you share it. So looking at the availability of social platforms and streaming platforms that we have quite literally at our fingertips. So we have Facebook and Facebook Live, Instagram and Instagram Lives, YouTube's, TikToks, WhatsApp, FaceTimes. So there's a multitude of ways for us to be able to stay connected and share our touch in a different type of way. One of the things that we've been working on here at Dermalogica that we really want to be able to share with you and want you guys to be able to have all of the tools to implement is the Power of ProSkin. Our Power of ProSkin campaign has been something that we have been working on in live situations. It's taking education to consumers. So we are an education company. That is what we do. And you, as a professional skin therapist, know everything there is to know about the skin. So this is an opportunity now for us to be able to reach out and share that with our clients via social platforms if you're not able to share it one-on-one with your clients in your treatment room. The Power of ProSkin is designed to help you to be able to deliver your professional advice, your professional expertise to your clients in a virtual manner. So I want to start by sharing some resources with you that we're going to be providing. You're going to find them in our resource folder and they will be in your country folders too. So we have social media activity for you. So you can see here there are different posts that you can post on social media to be able to get your clients and your maybe prospective clients for the future excited about what it is that you can share. So ask me, I'm a professional skin therapist, pro tips of things that are specific to ingredients or what you need to do for a very specific skin concern. The other thing that we have here as one of the examples is an e-blast that you can send out to your clients that's talking about the Power of ProSkin, how you can educate them, and asking if they have questions, because you are here to be able to answer them. So it's about starting to create a buzz, how you can then reach out to your clients, stay connected in a different type of way. Share your touch, share your expertise in a different type of way. and keep your business top of your client's mind. So let's look at some suggestions that you can do with the power of ProSkin. One of the things that I really encourage you to do is go live. You do not need to have fancy setups like we have today. I've got a mic hanging above my head and lights all over the place. You don't need that. You need a phone. That's all you need. You need a phone, you can go live, you can start streaming. So you can use Facebook Live, you could use Instagram Live. If you feel more comfortable, you could pre-record and post them on your stories and answer the questions that are coming in from your stories. One of the things that we would suggest that you do is Q&As. So reach out to your clients and ask them what questions they have and let them know that you are going to be there to answer them, and you can answer them live. So here's an example, as you can see on the screen. This is actually one of our instructors. This is Daniela. So she went live on the Dermalogica Instagram page and was asking questions. So it's a constant feed. If you have a lot of people on there, you have to be quick knowing what's going on, but it helps to be able to keep that engagement. It helps you to be able to talk to your clients in that social distancing environment and keep that engagement. You could have quick tips. So maybe rather than having a live Q&A, you could do live sections where you're giving your clients skincare advice. So what's good skincare advice in our current climate? Maybe it's hands. Maybe people have cracked, chapped hands from all of the hand washing and hand sanitizers. Quick tips to be able to help with the dryness of their hands. Maybe it's a quick tip for somebody that's been inside for a long time and really is feeling kind of like dull and lackluster, or what can I do to revitalize my skin and feel better about myself? That could be a great tip. And also share what you're doing. As an expert, your clients want to know what you use on your skin. It's the number one question that our instructors here get. What is your home care routine? What is your favorite product? What are you using and how do you use it? So being able to go live on a social channel or to do a pre-recorded video, you could show a step-by-step of what you're doing at home to be able to keep your clients engaged, and they could follow along with you. So it's all about providing that key education through the power of professional skincare, the power of ProSkin. Another thing that you can do is host actual classes online. So there's a multitude of ways that you can do this, but let's start by talking why we want to do this. Because if we are in a situation where we are distancing ourselves from each other, there's a lack of connection, but there's also a lack of community. There's a lack of interaction. You may have seen that Netflix are now doing this. You can host a Netflix party, so you can kind of stream Netflix with your friends and interact with each other when you're not in the same room. You can do exactly the same thing with the power of ProSkin by being able to host a virtual masterclass. So you could do this on a streaming. Maybe you could use Skype to be able to do this with your clients, or you could stream it on one of your social media channels. But I love the idea of doing it on a Skype because that allows you to be able to see the other people too, and they can follow you along. So some ideas of being able to do a masterclass, maybe it is a skin bar lesson. So a step-by-step of what products your clients have. So have them Skype in with you, have their products in front of them, and you're going to talk them through step-by-step how to be able to utilize those products on their skin. One of the questions that we get all the time for consumers is layering. We don't know which product goes first. Am I supposed to put my serum on before my moisturizer, after my moisturizer? What if I'm using an oil? Does that go underneath it? Does that go on top of it? These are informational tidbits that you know and you can share remotely with your clients to keep engagement and keep community. Maybe you can talk about acne or aging or preventative skincare. So our master classes are something that we really encourage you to be able to do. Educate your clients. Make sure that they are informed about all of the things that they can be doing at home, especially if it's during a time where they are unable to come and see you in person. The connectivity for your client is vital. The connectivity for you is vital. And the connectivity for your business is what's going to help see you through this time. Another way to be able to do this, and maybe the way that you want to be able to start off, is one-on-ones. So one-on-one consultations with your clients. So you can do this by any FaceTime, video, chatting application that you have. I think a very quick and easy one for you to be able to do would be WhatsApp. I've yet to meet anybody that doesn't have WhatsApp, and you can video chat through that as well. So this is a great way for you to be able to see your client, have communication with them one-on-one, and be able to take a look at their skin. I know it's not the same as seeing them in person. I know it's not the same as being able to reach out and touch, but this is the next best thing that you are going to be able to do. Schedule those one-on-one appointments on your calendar, reach out to your clients and confirm them, and then you can contact them via your video chats. This will allow you to be able to face map, to be able to do ongoing recommendations for their skincare routine, and it can help you to convert those clients to retail. So if you are self-employed, you will be able to retail directly to that client, and we're going to be talking about some tips on how to do that. If you are working for a skin center or a spa, you could direct that client directly to your company's e-commerce site to be able to get the products that are correct for their particular skin concerns. Those one-on-one consultations are powerful to be able to do by those video chat. Designing a treatment at home is another alternative that you can do for your clients, especially if you are in a situation right now where you are not able to provide services for your clients, or if you have clients that maybe are slightly more vulnerable and are not able to come to you for services. What can we do to be able to maintain that professional skin health for your client while they're at home? So being able to formulate an at-home DIY skincare kit is an ideal way to be able to keep your client's skin in optimum health. So you can put together packages. One of the things that we've been loving doing with dermalogical products is using the Rapid Reveal Peel. So incorporating Rapid Reveal Peel within a package of products for the client with a step-by-step of how they do this treatment themselves at home. You could also one-on-one video chat that client and walk them step-by-step through how to do this. If you are putting together these types of kits for your clients to be able to purchase, for them to be able to do their skin treatments at home, the vital thing to be able to do is ensure that you are including something that is going to bounce back for a service once everything is up and running again in your skin centers. So include a gift card for a professional skin treatment with your professional grade products once your client is able to come back in and see you. Grab and go, or grab and glow, which is what we're liking to call it, is how we are suggesting that you try and keep your retail going. So if you have a POS system or a booking system, it will have a customer relationship management system attached to it. So it will allow you to outreach to your clients. This should have tracked what products they have purchased, the last time they had a treatment, and you'll be able to do outreach to those clients to do follow-up on what products they need to be buying next, and also which products you want them to be using in the future. If you're using our Face Mapping Pro has a CRM. So you're going to be able to utilize that information to keep on top of what products your clients are using. And was it 3 months since the last time your client bought their cleanser? It's time for a new cleanser. They're going to be running out. If you do not have a POS or a booking system, or you haven't been using Face Mapping Pro, Then your alternative is your consultation cards, or with Dermalogica, your skin fitness plans, where I know that you have all been completing those as your consultations and tracking from what your client has been using at home. That's an opportunity for you to pull those out, start making calls, start setting up consultations, start setting up video chats. Also, that's a great way to be able to invite your clients to be able to join you for a virtual masterclass, sharing all of your knowledge and giving them some information and connectivity. If you are retailing product and you are currently in a location where you are closed, or it is difficult for a client to get to you, then you need to consider different ways to be able to deliver that product to your clients. Curbside pickup is an option. So are you able to let your client know that we're going to come out, drop the product, they can pull up curbside, they can pick the product up? Are you able to do door drops? So is that something that you're doing for maybe an hour each evening when there's not many people around? Drop it on the doors for your clients. You can take payments for these types of things with a credit card over the phone. It could be as easy as that. But maybe you could also use an online service such as Venmo, which we have in the US, or Zoom, which I believe is global. It's a PayPal associate, where you can take payments direct to bank account. If you're doing these types of grab and glow packages for your clients, where they're doing a curbside pickup, or you are helping to do a drop-off on door, surprise and delight that client. This time, more than any other time, people need connection. So a handwritten note in that pack of products. Maybe it's a little skincare tip. Maybe it's going back to those dry, cracked hands and you're leaving a little sample with a little tip on how to be able to use it to keep the hands hydrated. Of course, these are all things that we can do now. And I encourage you, do them now. Start today to get your business maintaining over time. But it's also important to remember that this is our for now. This is absolutely not our forever. So this is an opportunity to forward plan. So think about future-proofing your business. What are you going to do once your business is back 100%? How are you going to be able to get clients through the door? How are you going to be able to keep them enticed? How are you going to be able to make sure that the day that you open your door, you have got clients there coming in for treatments and you are going to be able to build your business back up? One of the things, and I love this idea, I've kind of been sharing it around with a few people because we've had a lot of skin therapists talking about the fact that I'm going to start giving myself skin treatments at home. I've been meaning to do Pro Power Peel and I keep putting it off. So now I'm going to do Pro Power Peel. So my suggestion to you is share it. Share your progress. Everybody loves the before and after. So if you're doing a Pro Power Peel on yourself, post your progress every time on your social media. Maybe you're starting using a new retail product. I've just started using overnight retinol repair again. So you could post your progress every day of the skin changes. This keeps the client excited about coming back and saying, my goodness, that's the difference that a professional skincare treatment can have on my skin. And it allows you to be able to start conversations on your social platform and reach out to those clients and book them for future treatments. Gift cards right now are key. If you do not have a gift card program, you need to start one immediately. And it can be as simple as you just printing some gift cards off of your computer and tracking it on a piece of paper. So gift cards selling now to use later. But I think the thing to remember with a gift card is, what is the added value to that? So there's been a lot of conversation here in the US with some of our professional skin therapists starting to sell gift cards for future, and there's been a lot of conversations about discounting. Should I discount my service? I have never discounted my service, but I want to be able to make sure that I have got some cash flow coming in. I want to make sure that I've got my clients ready to go when I'm reopening, or if it's a client that is not coming right now. My advice to you would be, do not discount, think of an added value. When we pass through these times, the first thing that people are going to be craving is touch. Because we're going to be separated. It's going to be tough on us. So you have that power of touch that you can deliver. So maybe your gift cards are not discounted, but including an additional touch therapy or additional massage technique. So realistically, you are discounting because you're giving that part of the service free of charge, but you're positioning it at an added value. So you're not underselling you, and you're not underselling your services, and you're giving your clients something that they are really going to be able to need when everything's back up and running. Take this time to be able to book client plans, consult with your clients. Were you halfway through a pro-power peel with a client and that client had to stop coming, or you're currently not in business? Contact that client, reach out, let's talk about what they can do at home, let's talk about what they can do and what our next steps are going to be once they come back and start having professional treatments. This is also an opportunity for you to learn a new skill. Is there something that you have been putting off with your business? Is there a new piece of equipment that you feel that you should have learned? Do you have that cooling contour mask gathering dust in the corner that you have never tried? Now's the time to do that. Dermalogica education all over the world is streaming. So you can take a class online. You can also take an on-demand class within your own time, or you can stream live with other professional skin therapists and with our instructor, where you can ask questions and interact and become involved. So I encourage you to take advantage, because when you are able to start doing services again, or your service business picks up, you can start talking to your clients about new skills and new information that you have learned to be able to get the businesses up and running. The most important thing that I want to share with you is we're in this together. We want you to be able to stay connected and look after you. We understand this is challenging times. We understand when you have built your entire career on touch and suddenly the world is saying, don't touch, that's a tough position to be in. But we really hope that we have shared some ideas with you today to be able to keep everything going and get you excited about some of the things that you can do to keep that connectivity. But it's also important that you're sharing those. Be part of the tribe, be part of the community. Whether you are on one of our professional Facebook page groups, then that's a great way to share your successes. But it's a great way to reach out and ask for help. Ask for support. Ask, what do you guys think? What are you doing? How can we do this differently? Has anybody tried streaming? What worked for you? We are also going to be there to support you every step of the way. If you are not already following Dermalogica Pro on Instagram, this is our global Instagram page specifically for professional skin therapists. So I would really encourage you to be able to join that group, and I would really encourage you to be able to join your professional Facebook group in the country that you are in, because you need the support. We want to be able to support you, and let's move forward and do our best together. Thank you so much, and I think maybe we might have some questions.
Thank you. Heather?
Yeah.
I'll read this quote because it's easy. You're a rock star.
Oh, thanks.
Love her and all the ideas she just threw at us. So I think that's exactly. I do want to iterate straight away, though, that the first thing I want is that the full session today, the video, the slides, and the resources are going to be on Dermalogica in this together shortly after the session finishes. This is an ongoing support that we would like to do. And so if you missed a bit, if you didn't hear the first 5 minutes, you can just fast forward to that. A lot of the questions that we're getting are about the question about when should I be opening? When should I stay open or should I be closed? And obviously a lot of that's about state and government
Correct.
Decisions. But I think from everything you've been saying, what's so interesting to me is that there isn't this concept of being closed. It's not really one, right? It's just, when should I be open? When should I be remote?
Right,
and
exactly.
when I'm remote.
It's like, when is it that I am no longer providing a touch service at this moment, but I am still providing a service? So those services may be remotely, those services may be incorporating drop-off for the product. Maybe you are opening your doors at certain times via appointment where the client can come in and pick up the product. So I think there's multiple ways that you can do this, but I 100% agree. Your doors are not closed, you're just functioning in a different way.
So a number of your sessions, like master classes, like consultations, basically, they're very interesting, they're very avant-garde, right? We're thinking about consumer education. We've been therapist education all this time. We're thinking about consumer education because the consumer is so much more knowledgeable.
Right.
Do you think the consumers are open to the sort of master classes and consultations? Have you had any experience where you would say that they are open to that?
Do you know, that's a great question. 100%. That if you think about any client on any given day with the amount of questions that they have, people want to know, and people want to know in community settings. They want it to be fun. They want it to be engaging. And I think a good example of that, but from a professional standpoint, would be with how we de-stream classes, and how we're starting now to do outreaches with what we're calling coffee chats with our professional skin therapists. You guys want to be part of that. You are your clients. So if you want to be part of a community, your clients want to be part of a community. And the number of questions that we get when we go live on Instagram it's out of control. We can't keep up with them. So if you're able to do that, the clients want to do it. I think it's also never making assumptions that your clients don't have the ability to video chat with you or don't have the ability to be able to get on Skype. I will tell you, my mother is 80, she has an iPad and she FaceTimes. She may still have a flip phone, but like one step at a time. So if she can do it, I know that your clients are out there doing it too.
In the last 15, 20 seconds ago, how do we make clients feel comfortable to return to the salon or spa once we get back?
That's a really great question. I think it all starts at this point in time. I'm going to have to say it starts with sanitation. So I think that you need to be able to send something out to your client, letting them know that the entire salon has been sanitized, that anything that had been an open tester type product has been switched out, and that you are in compliance with all of the country and the county regulations, and that you're ready to go. Let's go. You know, it might be that you're starting back small, maybe one client at a time, but I think that it's really just letting them know that everything's been sanitized and you're good to go.
Great. Well, look, thank you very, very much,
Thank you
Heather.
so much.
You know, we're getting a lot of questions here. We're going to try and answer a lot of them. There were a couple of questions about delays in shipping. At this point, we believe we're roughly keeping up with the shipping. There are questions about where we're sending them, and we're working on whether or not we can reroute shipments to people's home, to therapists' homes, rather than the practices that you may no longer be visiting. So we're working on that. We'll update you shortly. I'm thrilled that I get to announce another speaker, right? Because we've just talked about all these digital ways of doing things, which is great, but maybe you still need a bit of help sort of getting that digital thing started and thinking about which channel is right for you and how. We're in this area where we don't know all the right answers. It's a new world for everybody, and I think anybody who's saying anything else is not quite really that authentic. So we don't know, but it does mean that you can try different things. Try different things and you choose the one that works best. J.R. Little now is going to talk about, he's a global head of marketing, and he's going to talk about some of the things you could try in terms of digital. I think it's going to be illuminating. Thank you.
Hello, everyone. Thank you very much for joining us. Heather has talked about some of the tools that you can use to keep building a relationship with your customers, to keep contact with them, actually on a daily basis. But I know that some of you may not be that comfortable with some of these tools, or you may not be familiar with the new ways that you could be using them. I'm cognizant that many of you have small businesses on a high street, on a main street, and that you have depended on foot traffic over the years or word of mouth and people, strolling in and coming to your business. But this is probably a good time for us all to think about how could we improve the way we reach people digitally. And I want to talk a little bit about that today, and just to help you find some of the resources that you could use. Now, I have to giggle a little bit at the fact that I'm going to talk about technology and digital, and I have to acknowledge we've had some hiccups here today. But that's part of the process, and we shouldn't worry about perfection. An artist that I love, Salvador Dali, has a quote that says, "Don't worry about being perfect because you never will be." And so the idea is that you just try it, you learn, and then the next time you do it, it's going to be better. And so let's talk about some of the platforms that we could be using to stay connected to our customers who are so very dear to us. So I don't think anyone is surprised by the fact that people are spending a lot more time on these platforms, on these different digital brands that they can access from their homes. As a matter of fact, Amazon had announced yesterday that they're hiring 100,000 new people to help them support the massive amount of orders that they've been getting. I can also testify that we have seen a bump in our online sales in the early days of this pandemic. Of course, that may trail off, but it definitely proves that in these times where people are staying inside, they are staying connected digitally. And so we should try to do that too. Maybe we only have 10, 20, 100 connections, but we should still keep speaking with them and building our relationships on a daily basis, so that when this pandemic ends, so that when we get through this, they will feel close to us and they will want to come back into our businesses, if for nothing else, to give us a hug out of their appreciation. So, steps that we can take today. I'm very mindful that some of us are really thinking about how are we going to support ourselves over the next 2 weeks to 1 month to 3 months. So I want to be mindful to give some thoughts about what we could do immediately, but then some things that we may want to plan over time so that when we get through this, our business can really come out the gate thriving and get that revenue coming in. And we will get through this. What goes down must go up. And so let's be prepared for that time of going up. So today, all of us can take time to really upskill ourselves about these different platforms that we may want to incorporate into our businesses, either immediately or over time. The second thing is to create a simple plan. And when I say a simple plan, that might just be write it out, make a list, put it on a piece of paper. Typing it will make you feel better about it and will increase the chances that we will do it or you will do it. So make a plan. Maybe your plan is just to send an email to every one of your customers on a daily basis. Maybe your plan is to live stream every day at noon. Maybe your plan is to post 3 different posts every day throughout this period. But make some sort of a plan and try to keep to that plan. The third thing you can do immediately is you can download some social media and imagery assets that we are making available at the website you see there, dermalogica.com/inthistogether. So over the last 24 hours, some of our team have put together guidelines on how to use different social media platforms. And then some of our team have made social media posts and collected imagery that we want to give to you so that you can repurpose as you see fit. But we've also done this so that they can serve as inspiration. During this time period, you may need to start to be more of a marketer for your small business and a little bit more of a digital marketer. So these are things we can do today. But then what could we do tomorrow? As we heard earlier, we don't know how long we're going to be in this situation, but we can take control and start to prepare ourselves for post this situation. So things we can do tomorrow is we can start organic outreach. Now, organic in the world of social media means you don't spend money to do it. It means you just post and then people see that from your natural sharing of it. We can test paid social ads. Now that might not be something you want to do this week or even next week or the week after, but you may find that over time you need to advertise to your community digitally, and so you can start to experiment in that area. You will want to follow up with customers. Maybe you don't feel comfortable doing that today or tomorrow, but in time you will need to reach out to your customers and let them know that you are here and that eventually you are open for business. And then, of course, revise the plan as needed. During these times, a sense of control is very helpful. So regularly make a plan about what you want to do, whether that's posting, whether that's phone calls, whether that's live streaming, or whether that is actually setting up your business online in a little bit more of a structured and professional way, as we will cover in a moment. So, the first thing is to familiarize ourselves with these social media platforms. Now, things like Google, Facebook, we call these things platforms because they offer numerous ways that you can stay connected to people. And if you were a small business, if you were running a spa in a small town, then you would probably want to prioritize Google Maps, Google Search, Facebook, Instagram, and some sort of a means for emailing your customers. I want to start with Facebook and Instagram. Now, I know there's a lot of copy on this slide, but this presentation is being recorded and will be provided to you after we are done live streaming. So you'll be able to see this in more detail. The first thing, if you need to familiarize yourself with Facebook from a business perspective, is to go to Facebook for Business. You can easily Google and search for that and find that link. We will provide that link. And on there, you will be led through a training of how to use Facebook to promote your business. Now, if you want to run advertising one day, you will need to start a small business page. However, if you have been using your personal profile and you have been staying connected to your customers that way, you can, of course, continue to post as usual, and you can do that immediately. So some considerations when you start to use Facebook more. You would start organic. Again, organic means you would post without putting any money behind those posts, so you would not run them as ads. You will keep the content fresh. You will post regularly. You will keep the content relevant. So potentially one of your posts would say something to the effect of, staying inside more? Maybe this is a good time for Rapid Reveal Peel. And maybe mention that you are willing to deliver it to their homes. Or you could let your customers know that your spa, your business is very much still open. It's just that you're going to be communicating through video chat or other means. When the time is right, let's say it's 3 weeks from now, 4 weeks from now, maybe it's a month from now, or even longer, if you want to start to run ads, you can do that with a very small amount of budget, with a very small amount of spend. And you can test and you can learn and you can see how that works for your business. You will also want to target very wisely if you do that. So you'll want to set the filters, and the filters is the steps to target your ad to people that will be relevant. So that would likely be the type of customers that you have today and the town that you live in. WhatsApp is also a great way to stay connected, as Heather has mentioned. A lot of people didn't realize that WhatsApp is actually owned by Facebook, as well as Instagram. So when you go to the Facebook for Business, you will learn about those services and platforms as well. So another thing I want to mention, and this is something that's been announced over the last 24 hours, is that Facebook is offering small business grants for those that have been impacted by this pandemic. So if you already use Facebook to promote your business, I would strongly encourage you to probably go to that link today and to see how you might be able to get a grant from Facebook to help your business. In some instances, they are giving cash. In other instances, they are giving credits of free advertising on their platform. Video chat, phone, email, messaging, text, These are all things that Heather referenced during her presentation. I know that many of you are already using some of these customer contact tools, whether that is Forest or Booker or Zenoti. But many of you, maybe you don't have access to those types of tools, but you do have a large email list of your customers. You may find that a service like MailChimp is easy for you and works well for you. But again, we should be messaging our customers often so that they know we are there for them, we can answer their questions, we can provide them with their products, and so that we're building that relationship to reopen our businesses in time. And again, one-on-one chats. This is increasingly important in our industry. And even before we were in this pandemic, we were seeing an increase in the amount of skin consultations from competitors that are happening through video chats. So of course, we should all feel free and have the confidence that that is a great way to provide skin advice. Now, whilst maybe it's not important today, in time, as you want to prepare your business for the post-pandemic, you will want to think more about Google. And you can go to Google Ads, and ironically, you can Google that, and you can find the link that will walk you through all of the different ways to promote your business on Google. It's a self-led site, but unfortunately, the learning section is a little difficult to find. If you scroll to the bottom, you will find it in the footer. There is another site by Google called Google My Business. This is a little bit focused on Google Maps, which, by the way, you do not have to have a website to have your business on Google Maps. Google is an enormous company, and there's more than one place where you can get information about how to build your business with them. That's why I have referenced Google Ads as well as Google My Business. I would encourage everyone to start with Maps so that when we get through this time, your business is easily accessible and easy to find by customers who may be looking for similar services. And in time, you may want to run some search ads on Google so that when people are looking for a business similar to yours, you could pay to make them aware that you exist and that you're open for business. So, I've went through the beginning steps of how to get started on some of these platforms, and I've mentioned some of the resources. We have also created some how-to guides. Our education team has written them. They are on dermalogica.com/inthistogether, as well as some of those visual assets that we have created that you can freely use on your platforms. For other trainings provided by the platforms, you will see the links there. For Facebook grants, you will see that link as well. And for any other questions you have, any other concerns, any other advice that you want or direction, please contact your business consultant or the equivalent of a business consultant that you have in your country. Thank you very much for your time.
Well, thank you, JR. That's a very powerful presentation. There was a lot of information in there that actually I wasn't aware of. I think for a lot of people, you'll be looking at this and like, oh my God, that was hard. Where do I start? So I wanted to reiterate that all these materials are going to be on dermalogica.com/inthistogether, and we will continue to post that. So for example, we've just had questions, very good questions from the audience about could we get scripts for the master classes that the therapist would be running? Yeah. So let's find a way. And when we do those, we'll put those on that same website. In the interest of time, I think we are going to move. You covered all the great questions. I do think, if we see what JR's put together here, it's there's a lot of intellectual thought into this of how to do this. And he's also in charge, and together with our research and development people, put out our new innovations. And you can tell you that those are going to be incredible as well once we get back into the sort of normal thing, as a swing of things. You heard a moment ago that Facebook grants was, were available, and I think that's sort of a theme, right? There's lots and lots of places where people are coming together. Like Dermalogica and the Tribe's there for you, but honestly, the great, beautiful thing about this is globally, governments are coming together, and people are doing things who previously maybe had not extended that generosity. So just like that Facebook grant is there are other places you can turn for help, financial and such. And so it's a great pleasure that I'm introducing Stuart, who's our CFO, and he's been doing a lot of the legwork over the last days to try and help you sort of kickstart you on that road and make sure you get your fair share, and that somebody who wants to help can be connected to you. So, Stuart.
Thank you, Aurelian. So, good morning, good afternoon, good evening. As Aurelian mentioned, I'm Stuart, and I'm the Chief Financial Officer for Dermalogica. What I'm going to talk to you about today is very current for me, because what I'm talking to you about is exactly what I'm doing and my team are doing for Dermalogica. In some respects, we're no different at all to you. Even a small drop in revenue can bite quite quickly. It can bite quickly any business and can turn your cash flow negative. So what I'm doing is the same as I think you need to do. What I would advise all of us to do is to have a plan. JR mentioned the need to have a plan when it comes to your social strategy. I would say when it comes to cash flow and your finances, you need to have a plan. And sometimes we don't do plans because we don't like what it tells us. That's no reason not to do a plan. I quite like the quote you'll see on screen from Benjamin Franklin, is that failing to prepare is you're preparing to fail. So I would urge all of you, if there's one thing you take from my presentation today, is to sit down and start to make a plan. So step number one, I would advise you all to build a plan. We've got some resources to help you do that, so I'll come back to that at the end. I think the other point that I would like to make is that whilst we're in the sort of throes of this crisis, we need a short-term plan. But as others have mentioned, it will take time to really get back to business as normal. If you imagine a scenario where you've potentially sold gift cards, but you've already taken the cash, therefore as people come back, potentially your revenues don't return to the level that they were as quickly as you would like. If you've delayed certain payments, then potentially you've got a period where revenues are slightly lower, your payments are slightly higher, and therefore the pressure on your business cash flow as you start to ramp back up again is also going to be quite tense. So, it's not a case that as soon as this is over, we throw, caution to the wind and spend with carefree abandon. I would advise you to have a plan that sees you through the crisis and then sees you into, returning to business as normal. First and foremost, you've heard from Heather, you've heard from JR about how you might maximize your revenue streams, even if your business is closed. Because, even having some revenue is extremely positive for your cash flow plan. Secondly, I would say if you can reduce costs, of course we can delay, but if there is a way that you can actually reduce costs, that's where I would start. An example might be, speak to your landlord. Is there a way you can reduce rent? We've got some resources that I'll talk about later. We've prepared a letter to help you do that, but are there costs that I can take out? And I'll talk a bit later about sick pay and the support that you get from that. But first and foremost, sit down with all of your costs and work out where can I negotiate them lower, where can I take them out, where will they naturally come out. Things like utilities. If your location is closed, then there's a good chance that your utilities you will not be spending at the same rate. Insurance. I'd be very careful with insurance. I think it's a cost that you can talk to the insurance company. Just make sure that in doing so that it's still valid. You don't want to be in a situation where there's an incident and you find you're not covered. So I think insurance is also an option, but you need to do it carefully. So I think there's a whole area when you really sit down and look at all the costs of your business, that there's an opportunity to reduce costs. The next thing I would advise you to do is look at how you can extend credit. So if you can't reduce a cost, work with your suppliers, work with whether it's mortgage companies, whether it's insurers, to work out how you might be able to extend credit. As Dermalogica, we will help you with this. We'll do our bit, and I'll talk about that a little bit later. But again, if you can move your payments to when you're having higher revenues, then you've got a good chance of sustaining through this. When you do the plan, it is going to indicate times when you've got potentially funding gaps or where your cash flow is negative. Most of us in our personal lives tend to look at credit cards, tend to look at overdrafts as opportunities to bridge those gaps. They are expensive. Yep. So for the odd day, the odd couple of days, yes, that's a possibility. But I would advise you, if you have a sustained period where it looks like you need cash in your business, there are cheaper ways of getting money through loans. And actually, when I go to the next slide in a minute and talk about support, there's actually already, possible things out there to help you. And JR mentions that Facebook are also looking to provide loans. There are opportunities out there to help you. And as I said, in the next slide, I'll talk to you about the support that's available. So, thinking about the different support schemes that are out there. Now, it is not easy navigating everything that's out there, all of the news, everything that you read. So as Dermalogica, we really plan to help you with this. It is different by state in the US. It is different by country, whether that's in Europe, Asia, Africa. Every country is slightly different. The good news is we have local teams, local experts on the ground, and those people will help you understand the situation for you. So it's difficult for me to talk very specifically because everything is different. But if I look at what I've seen across the UK and the US, for example, the UK's announced mortgage relief, up to 3 months of being able to delay mortgage payments, which help your employees, but also potentially help you as business owners. For unemployment, should we get to the point where people are unemployed, if I look at New York, if I look at the UK, the period that people have to wait in order to claim unemployment benefits or unemployment insurance has been reduced. The process by which you apply, for example, in the UK, you no longer need to go to the job centre in order to make the application. So the agencies and the governments out there are leaning in to try and make this easier for employees. They're also leaning in with regards to sick pay, because hopefully this is all over relatively quickly. We can all return to work relatively quickly. So, governments and states are asking companies to provide extra sick leave. For small businesses, like most of yours, they are also funding that. So there's an opportunity to maintain your workforce. There's also a scheme, for example, in California, where if you've got reduced hours, so if you're finding a way to be productive for, say, half the time, there's an opportunity in California where you can kind of do part-funded sick leave by the state, but also then where you've got productive hours, you can then use your staff for that. So there's lots and lots of options out there to support your employees. As the employer or as the company, there are things to support you as well. So whether it's payroll taxes in California, which the state have said you can delay. So, that's pushing costs to a time when potentially you have the revenue. Whether it's in the UK having a 12-month reduction in business rates, which was announced, I believe yesterday. So, and whether it's then supporting and paying for sick leave. If you are a company with less than 500 people in the US, there's a good chance that the support services you provide for your employees, that there is support for you as a business. Cash grants. Both the UK and the US are offering cash grants for small businesses. Why would I take a cash grant before I took a loan? Well, a grant in its sense is not expected to pay back. So you need to make sure you meet the criteria. I'm pretty confident that a number of your businesses in a number of these different markets will meet that criteria. Don't exactly know yet what the application process is, but we'll make sure we understand those details and help you. But there are cash grants out there to help your businesses. After that, there's also low interest loans. So for me, this comes back to what I said earlier about the plan. If you have a plan that has a cash flow deficit for a sustained period, that is not bridged by one of the other things that I mentioned, potentially a loan is better for you than using your overdraft or your credit card. In both the UK and the US, I think the US has announced interest-free loans. The UK certainly are talking about an interest-free period, certainly for the first 3 to 6 months, and then low interest rates for the longer term. These could be effective ways of funding your business as you return to normal. So there's lots and lots of support out there. I've used the UK and the US as examples. There's many more countries and very different schemes. We will make sure we support you on that. So finally, we have an obligation not only to make sure, my job is to make sure that Dermalogica survives and thrives through this situation, but we're also here to support you. We operate very slightly differently in every single market, so I can't talk about exact specifics here, but what I can say is that we are committed to improving your cash flow everywhere. That might look slightly differently in different markets, but I give you all a commitment that we will help you with credit terms, with cash flow, through the period that this, let's say, crisis endures, number one. Number two, Aurélien mentioned earlier that we're trying to find ways, if your salon is closed, to help you continue to sell product and support and supply your customer base. We are committed to trying to find flexible solutions for that. And again, they're slightly different by market, but I'm really, really confident we can find ways to help you continue to drive retail sales in your business. Third thing would be advice. Like I said, we've about 1,200 people in Dermalogica worldwide, and we've got lots of experts in each country available to help you navigate. For example, some of the stuff that I presented before, for example, cash flow. If there is a call, people feel that they would benefit from, say, some online learning sessions beyond what we normally provide, myself and my team would be happy to run a learning workshop for a group of people about how to put together a cash flow. And we will try to help you again with some of these resources and support schemes that you see in each country. Education and assets, I think you've seen a lot of those today. I guess I don't have much to add to that, but we have resources, we have assets, and we want to share them with you. And then finally, and I believe there'll be a link shared at the end of the presentation or shortly after, we have genuine tools which will help you with this. I personally sat down and built an Excel-based cash flow model to help you, which we'll be sharing. Our head of legal, Robert, has also put together a landlord letter template that you can send to your landlord to try and negotiate lower rent and management fees. And there will be more things that we will add. So, it's a difficult situation. Like I said, I'm dealing with this for Dermalogica in the same way that you're dealing with it with your businesses, but we really are here to help. Thank you.
All right. So, thank you, Stuart. I'm actually going to come across. So I'll give you, here you go. Thank you. It's the appropriate way to do it. I'm not allowed to touch that. All right. We'll get there. We'll get there, right? It takes a while. Look, we're coming to a close. Thank you ever so much for being part of today. It's at times like this that really you want to, you have to connect, right? And there's a lot of really good advice, hopefully, that you've heard today. The first person from the Dermalogica organization that we'd recommend a therapist reaches out to is your local business consultant and their educators. They may be working from home, but they're still working on your behalf. So please get in touch with them, and if you need to have connection details for some reason, please just let us know. But they are there for you. On a step larger than that, you can connect with the tribe, right? Because the truth is, Dermalogica isn't the center of all knowledge on this thing. We're not. We're doing our best. We're pulling together things, and we're trying to make it easy to digest, but there is so much out there. So, the power of the tribe is the immense number of people. So on Dermalogica Pro and in the Facebook groups, we're really hoping to see lots and lots of of posts of things that our tribe are doing that works. If you've got something that's starting to resonate in your area, please share it, right? And it's these sharing platforms that together will move it. And then all we can do is highlight the ones that are really getting resonance. We're not going to come up with all the ideas. But you can see it's a long list, right? And on all the difficult and different symbols that you've got. Of course, it's really important that we get it all together in one resource center. Dermalogica.com in this together. This is the resource center for everything about this situation we're now in, about the virus, about the business in the time of the pandemic, and how we take it forward. I'd like this page of our website to be the most heavily trafficked page that we have. We're replicating it, the same website in multiple areas, so no matter where you're in the world, that you should be able to get to it. There's links and resources. So when we, for example, talk about the sort of summaries of some of the things you can do in California, let's put that link on there. And that is what we've started to build out. This page has only been up for a day, but I believe it's the right way forward. And it's going to have so much information, and it's hopefully going to just get richer and richer. So as we finish today, I think we're in this together. That's what it's about. I'd like to thank everybody who came together to do this. There are only about half a dozen people in a really big closed office who are here this morning to try and bring you this live stream. The hiccups happened. Yeah, we've been streaming people in from their homes because they couldn't leave their homes in San Francisco. The doctor, the epidemiologist. These sort of things cause hiccups. But we made it happen, and the quality on the next upload, which will be available in a couple of hours, is going to be good. And most importantly, the resources are there. So, yesterday morning, something unique happened in Venice. So we looked outside, and there was a rainbow. There's lots of things to think about, which are really positive. And so on that note, one of my favorite songs, Don't Stop Believing. We're going to keep going. It's going to be good. We're there for you, and just enjoy it. All right, thank you very much. It's been a great day.